Hello, everyone. Let's talk about one of the biggest challenges we face as orthodontists today, and that's the sheer volume of data we're expected to handle. We spend so much time collecting countless measurements, but you have to ask yourself, does all that information really help us make better decisions, or is it just slowing us down? Here's a statement I truly believe in. Orthodontists are drowning in data. My name is Dr. Martin Baxmann, and what I want to do today is show you how we can cut through all that unnecessary noise in our diagnostic process, how we can focus on what actually matters for getting efficient, successful results. You see, when we have too much data, it often becomes what I call a blind grenade. It's this explosion of irrelevant details that just distracts us from the real clinical problem we need to solve. Imagine that complex TMJ patient who comes in with a file 2 inches thick. Now, of course, we have to listen with empathy, but our job as clinicians, as leaders, is to have the discipline to filter through that noise and pinpoint the few facts that are truly relevant to our treatment plan. So how do we actually do that? Well, it all starts with having the right tools. And I'm talking about tools that are designed for clarity and for speed, not for adding more complexity. Let's walk through a few systems you can put into practice right away. First up is the 5-second model analysis. Now, I know it sounds almost too simple to work, but it's incredibly powerful. In literally just a few seconds, you can get a solid assessment of symmetry, crowding, and the basic spatial relationships. You ask one simple, decisive question. Do we have enough space, and are the teeth where they should be? That quick check immediately points you toward the heart of the treatment plan. Next are what I call the Baxmann keys. Think of these as a few non-negotiable rules that give you a stable, predictable result. They act as a super simple checklist at every single appointment. You don't need to track 40 different measurements to know if you're on track. You just need to ask, are the canines in class 1? Is that midline centered on the face? And are the molars in a stable relationship? If the answer is yes, you know you're heading in the right direction. It's about replacing complexity with absolute clarity. Okay, now let's apply these same lean principles to one of the most data-heavy things we do, cephalometric analysis. We can absolutely get maximum insight from minimum data here. I am sure this feels familiar to many of you. I remember back in school learning these analyses that felt like they had 10,000 values. We'd memorize all these angles and planes that, let's be honest, we never used again. And the reason we forget them isn't because we're bad doctors. It's because most of that stuff is clinically irrelevant for probably 80% of our cases. And that is precisely why I developed a lean ceph analysis that uses only 10 values. That's it, just 10. And I'm telling you, with these 10 values, you can get everything you truly need to make a clear strategic decision. Now, these 10 values are so powerful because they cover 4 absolutely critical areas. They tell us about the skeletal relationship between the jaws, the incisor position, and any associated risks, the vertical dimension, and of course, the patient's remaining growth potential. With this focused data set, we get the entire strategic picture without the usual headache. So once we have a lean diagnosis, it only makes sense that we need a lean plan, right? This philosophy has to extend directly into how we make strategic decisions, especially for those common cases that can often feel really complex. Let's take a look at how this works for Class 2 malocclusions using something I call the ABCD system. Instead of getting paralyzed by dozens of different options, we just categorize them into 4 clear pathways. A is for functional orthopedics, using the patient's own growth. B is for fixed appliances, like the Herbst. C would be your extraction cases. And D is for surgery in those significant skeletal discrepancies. This framework just eliminates that paralysis of choice and lets you plan quickly and with confidence. So, whether we're talking about that 5-second analysis, the 10-value ceph, or the ABCD system, all of these tools, they're all pointing toward one single unifying goal. And that goal is clarity. The whole point here is to reduce complexity so that we, as clinicians and as the leaders of our practices, can act with confidence and with efficiency. And this really gets to the heart of the philosophy. This is not about cutting corners. It's not about compromising patient care in any way. It is about cutting out the confusion so we can focus our expertise right where it matters most. And when you achieve that kind of clarity, the impact is, well, it's profound. It means you can treat more patients more effectively. It leads to better, more stable clinical outcomes. And maybe most important for us, it dramatically reduces professional stress and burnout, both for you and your team. That's absolutely vital for the long-term growth of your practice and for your own well-being. So I'll leave you with this question to think about. What is the biggest source of noise in your practice? Because identifying it is the very first step toward creating a more efficient, more focused, and ultimately a more successful clinical environment. Thank you for your time.